morning, everybody. I hope you're well. Just a quick little video this morning, just using my little annotation tool that might help clarify some movement points of performance for patients who are in the early stages of their NeuroHAB program, or they may be in the post-op phase, and they're taking their first steps out of bed after having had lumbar spine surgery. And of course, we always tell our patients to focus on movement proficiency. And so one of the common things that we see in patients who are just learning what we mean by biomechanical movement proficiency is what we'll talk about this morning. So just in terms of my diagram, we have our cervical spine, thoracic spine, and our lumbar spine. This is our pelvis, which is anteriorly tilted for a bending task. There's our knee, there's our foot. Okay, so that's just to clarify what I'm drawing, because I know my drawing is not that easy to interpret. So that's what we're going to be using when I explain this. So one of the things that patients do in the very early phases is they tend to do this. When we say bend forward, they tend to do this movement, and it's not terrible, because they're very focused on, yes, I understand this neutral position, and we use the broomstick to help with that tactile cue. That's why we use the broomstick up against the body as they're doing their movement training, or their movement therapy. So we use the broomstick, and so that they understand that very well. But one of the common mistakes is that they tend to do this, okay? And so their knees are there, and then their leg is there, there's their thigh, and there's their foot. And this is sort of like a bit of a woodpecker movement. And why we don't want that to happen is because that obviously creates a fair bit of demand on the, let's use a different colour, that creates a fair bit of demand on the posterior kinetic chain, which is a muscular ligamentous band that runs up the back of the body. And when that hits tension, the actual amount of hinging here, the degrees that you can actually bend forward, is pretty limited if you keep this part of your body dead straight. Okay, so it doesn't really allow you to do very much. And what would happen, just say you were opening up a drawer, or bending forward to a table to pick something up off a table, just say it's your coffee cup or something, you would, if you had that default movement pattern, you would obviously struggle to reach it because the range of motion is poor. And as a consequence of that, you'd probably start to develop some dysfunctional movement and start to bend forward through here. Okay, so then you lose your neutral position. Okay, and that's simply because you've failed to unload that posterior kinetic chain a little bit to allow more range of motion. So what do we want? What would we rather see? We would rather see this. We would rather see the movement pattern that looks more like this. So there's our, just pretend that's our cervical, thoracic, lumbar, with its neutral spine, pelvis. So what we can do to detension our our posterior kinetic chain is to allow a little bit of flexion at the knees. So we allow a little bit of flexion at the knees. Okay, so that immediately detensions the posterior kinetic chain. But because the hips have moved backwards in this hip hinge position, that's the primary movement. The first movement is hips going back. You've still maintained tension in the posterior kinetic chain. Okay, so the posterior kinetic chain is still active. The posterior kinetic chain is still active, but the range of motion is now greater. The range of motion is now greater. So when you bend forward to do a task, so you're picking up your coffee cup again, you can reach the task. Okay, you can reach the task, and it is a useful movement to apply in your daily activities. All right, but if you don't bend at the knee there, your range of motion is very restricted, and so it's not actually helpful, and you'll end up doing it poorly. Whereas when you do this, when you allow the knee to flex, in actual fact I should draw that better. I'm going to just draw that a little bit better. When I allow the knee to flex with the primary movement of the hip going backwards, now I've got a nice hip hinge position, okay, and now I can do a task, okay. The posterior kinetic chain range of motion is greater. It's still active, okay, it's still active, and therefore contracting and improving the stability of the lumbar segments. Multifidus is activated, which of course is critically important. And then the other mistake that we sometimes see is this movement pattern here, where the knee is coming forward. Okay, the knee is coming forward, and there's less torso bend. Okay, so the knee comes forward, and that allows you to reach your range of motion, but your hips are not primarily going backwards. You're just sort of the first movement is down. That becomes your first movement, as opposed to, so that's not good. And the hips going back is the required first movement. But people do that because they need to do a task to pick up their coffee cup, and because the motor patterns are not quite optimized yet, they drop down. Their hips drop down as the first movement. Their knees come forward associated with that. They can then do the task, but the consequence of that dysfunctional motor pattern is that the posterior kinetic chain deactivates. Okay, so that deactivates the posterior kinetic chain, and we don't want that. We want to have an activated posterior kinetic chain, and they sort of do that as well because, you know, especially in the post-op period, or if they've got a lot of back pain, that motor pattern kind of limits the biomechanical stress on that part of their spine here, and so they feel as though that will accomplish the task with less pain. But it's dysfunctional because it doesn't condition the posterior kinetic chain, which of course is absolutely essential to re-establish the health and stability of the lumbar spine segments. You have to have a healthy, conditioned posterior kinetic chain to keep these, you know, lumbar vertebrae 1, 2, 3, 4, 5, S1 stable. All right, so that's some of the common mistakes that I see, and I hope that helps explain it. All the best, bye.